Hello, my name is Dr. Dewan S. Raja. Today I will discuss about lymphatic drainage of the large intestine. The lymphatic drainage of the large intestine follows a pathway that generally mirrors the arterial supply of the region. The lymphatic vessels drain into specific groups of lymph nodes, which ultimately drain into the thoracic duct. As for example, cecum and appendix lymph nodes involved is ileocholic lymph node, which lie around the ileocholic artery, that is a branch of superior mesenteric artery. Drainage path lymph from the cecum and appendix drains into the ileocholic lymph node. From ileocholic lymph node, lymph moves to the superior mesenteric lymph node. Okay, so this is the ileocholic region. So from there, the lymph will go to the ileocholic lymph node. Ultimately, it will go to the superior mesenteric lymph node. Ascending colon lymph nodes involve paracholic lymph nodes along the ascending colon, intermediate mesenteric lymph nodes, drainage path lymph from ascending colon drains into the paracholic and intermediate mesenteric nodes. From there, it flows to the superior mesenteric lymph node. From the transverse colon, lymph nodes involve middle cholic lymph nodes. Drainage path lymph from the transverse colon drains into middle cholic lymph node, which then drains into superior mesenteric lymph node. So the structures which are derived from the midgut supplied by the superior mesenteric artery, the lymphatics from those part of the gut, the large intestine, goes to the superior mesenteric lymph node. Okay, so this is here appendix cecum will go to the superior mesenteric lymph node area gradually. Okay, then from the ascending colon we have the right cholic artery supplies ascending colon, that is also going to the superior mesenteric lymph node. Okay, we'll go to the superior mesenteric lymph node here. Then if we go to the middle cholic artery supply here from the transverse colon, again it go to the superior mesenteric lymph node. We got the superior mesenteric lymph node. Then we'll go to the splenic flexure descending colon. Arterial supply from left cholic artery, lymphatics will go to the inferior mesenteric lymph node. This is the inferior mesenteric artery. We have lymph node around it, inferior mesenteric lymph node. Like the sigmoid colon, that also goes to the inferior mesenteric lymph node. Okay, so this is the inferior mesenteric lymph node. Rectum, upper part of rectum goes to the inferior mesenteric lymph node. The lymph from the rectum, upper part, goes to the inferior mesenteric lymph node. So here again, descending colon lymph node involve paracholic lymph node, intermediate lymph nodes associated with the left cholic artery. Drainage path lymph from the descending colon drains into the paracholic and left cholic nodes, and from there it moves to the inferior mesenteric lymph nodes. From the sigmoid colon, if you go to the sigmoid colon, lymph involves sigmoid lymph nodes along the branches of the sigmoid arteries. Drainage path, lymph from the sigmoid colon drains into the sigmoid lymph nodes and then to the inferior mesenteric lymph nodes. Rectum. Okay, rectum has different type of blood supply, not only the inferior mesenteric artery, it also get blood supply from the internal iliac artery as well as the internal pudendal artery. Okay, so lymph drain from the upper rectum to the pararectal lymph node, then to the inferior mesenteric lymph nodes. Middle and lower rectum lymph can drain to the internal iliac lymph nodes. From anorectal junction and anal canal, area superior to the pectinate muscle drains into internal iliac lymph nodes. The area inferior to the pectinate line drains into superficial inguinal lymph nodes. Okay, this is the summary from Gray's Atlas of Anatomy. Here we are seeing the lymph nodes. Here a group of lymph node, inferior mesenteric lymph nodes here, and mesenteric arteries here, and we'll get the superior mesenteric artery. Okay, here we'll go to the superior mesenteric artery just below the celiac trunk area, and this is the superior mesenteric artery. It ultimately it drains the lymph from the cecum, appendix, ascending colon, hepatic flexure, and up to proximal two-thirds of the transverse colon. So it will go to superior mesenteric lymph node. They are connected. Inferior mesenteric lymph node, superior mesenteric lymph node are connected by lymphatic ducts. From there, it will go to the cisterna chyli, then thoracic duct. Then it enters the thorax. Ultimately, it goes to the posterior mediastinum, superior mediastinum. It turns towards the left, and the thoracic duct dump at the junction between the left internal jugular vein and left subclavian vein. So this is the cisterna chyli. From the upper end, we get the thoracic duct. Thoracic duct enters the thorax through the aortic opening of diaphragm, and it passes through the posterior mediastinum, then the junction between posterior mediastinum and superior mediastinum, it turns towards the left and ultimately it reaches to the neck root and drains into the junction between left internal jugular vein and left subclavian vein. Okay, so let us go to the summary. Superior mesenteric lymph node drains cecum, appendix, ascending colon, and the proximal two-thirds of the transverse colon. Inferior mesenteric lymph node drains distal one-third of the transverse colon, descending colon, sigmoid colon, and upper rectum. Internal iliac and superficial inguinal lymph node drain part of lower rectum and anal canal. Lymph eventually flows from these groups into cisterna chyli, then into the thoracic duct, which empties into the venous system at the junction of the left subclavian and left internal jugular vein. Clinical significance of lymphatic drainage, that is very important to us. The lymphatic drainage of the large intestine has important clinical significance, particularly in the context of cancer, because cancer spread through the lymphatics initially, then it spread through the venous system. Okay, so infection also spread through the lymphatics, an inflammatory disease condition. There will be also enlargement of the lymph nodes. Colorectal cancer spread via the lymphatic vessel and lymph nodes. Sentinel lymph nodes, like a sentry initial guard, Lymph node biopsy is a common procedure. Lymphadenopathy and surgical planning. Lymphadenectomy and surgical planning. Surgeon can decide the location of cancer. Surgeon can take out part of the large intestine and surgeon take out the lymph nodes. Lymphadenopathy in inflammatory and infectious disease like that of tuberculosis. Okay, like that of tuberculosis. But if we remove lymph nodes, we might also consider there is complication like lymphedema and ascites due to obstruction of the lymphatic vessel. Lymphatic vessel is also important for diagnostic purpose, for imaging, diagnostic study of lymph nodes, and biopsy of the lymph node to classify and diagnose the cancer. Okay. So that's all about the lymphatic drainage of the large intestine. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me and have a nice and wonderful day. Bye now.